Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. I'm your host, Zen Sams. Up in just a few minutes in our newest monthly segment called The Rankin Difference, brought to you by David Rankin MD.com. We're featuring the many female voices and stories affected by breast implant illness, from your favorite celebrities, influencers, to your beloved stay-at-home mamas. We're going to bring you stories of truth, triumph, and survival. Joined by our expert and recurring contributor, Dr. David Rankin, a top breast explant expert in the U.S. and the chief of plastic surgery at St. Mary's Medical Center in West Palm Beach, Florida. Dr. Rankin has been in practice for well over 20 years, and he's very well respected in the BII community. He stopped breast augmentation procedures solely focusing on explanting. Today, we're joined by his patient and fellow breast implant illness warrior, Joy Corrigan. She's a model, actress, fashion designer, and a businesswoman. She's a former Sports Illustrated swimsuit model, Playboy Playmate, and Victoria's Secret model as well. She's also the co-founder of the clothing company Naked Species. Now, breast implant illness, otherwise known as BII, is a condition that just isn't well understood, but one that can be debilitating. I can vouch for that. BII refers to a wide range of inexplicable symptoms that can't be explained by the medical community that develop in women who have reconstruction or cosmetic enlargement with breast implants. Now, experts believe BII symptoms are caused by an autoimmune or inflammatory reaction to the actual implants. Today, we're chatting breast implant illness, Joy's explant journey, and the warning signs and symptoms your breasts are revealing, and of course, what most surgeons fail to disclose in your original consultation. Welcoming now to the show is my dear friend, Dr. David Rankin and Joy Corrigan. Welcome to the show, superstars.
Hey, Zen.
Hi. Thank you so much for having us.
Nice to see you, Joy. Welcome back, Dr. Rankin.
Thank you.
Okay, Joy, let's dive right in. So let's go back to the reason you got breast implants, okay? What was the motivation behind your decision? And I want to know, once you decided to augment your breasts, did you receive full disclosure and transparency from your surgeon about the potential complications and long-term costs involved to maintain them?
Well, I got my breast implants just over 12 years ago. And when I went to go get them, I wanted to fit this perfect look that I thought was perfect. I was trying to get into the modeling industry and I wanted to have fuller breasts and I wanted to be accepted and I wanted to be loved. And the doctor that I went to at the time, he did not explain anything except for that I could keep them in forever. There's no health issues, and that that it was going to be great. There's no downside to it. So I was excited. I trusted what he said. It was like he's a doctor, so I'm going to trust him. And I went and I did the surgery. And I was not aware of all the complications that would come down the road.
Okay, pause. We're going to get to those in a sec. So you did not receive full transparency, you did not receive full disclosure, and you were motivated to fit a societal norm based on the industry that you chose to work in, right? This is a recipe for disaster. Now I'm going to move to Dr. Rankin. Dr. Rankin, you've been in practice for well over 20 years and are well known in the BII community. In fact, you stopped breast augmentation procedures and solely focus on explanting. What drove you to this decision?
Just seeing more and more women having issues with their implants and beginning the explant process myself in my practice. It just I didn't really plan for this to happen and just to become solely doing explants. But the more women I saw, their health improving, I just felt like I had to stop implanting and really focus my practice on helping women in this regard.
And of course, you can't unsee what you saw. And I'm sure you saw a lot of skullduggery when it comes to breast implants and the condition that they are in once they are explanted. So thank you for making that decision. Now, interestingly enough, in 2019, the FDA called for a worldwide recall of all textured breast implants from the pharmaceutical company Allergan. And the FDA requested Allergan recall the implants because of a drastic increase in a rare and deadly form of cancer called breast implant associated anaplastic large cell lymphoma that's been associated specifically with Allergan's BIA-ALCL textured implants. Now, breast implant associated anaplastic large cell lymphoma is an immune system cancer that develops in the scar tissue capsule that forms around the breast implants. And of the 1,130 cases of the disease reported to the FDA, 953 patients had Allergan implants. And of the 59 deaths reported from the disease, 34 of the deceased patients had Allergan implants as of April of 2022. And this is according to FDA statistics. So this is very scary stuff. Okay, so thank you so much for being at the forefront of this battle, Dr. Rankin. Now, Joy, after experiencing many symptoms associated with BII, you had your implants removed and are now what they call an explant, as am I. How long did you have your implants for, and what type did you have? And when did symptoms first arise after the breast augmentation?
So I had my implants for 12 years, and I got I got silicone implants, and I had so many horrible symptoms, and I've had them out for now 6 months. And Dr. Rankin, he has definitely changed my life because all of these symptoms have slowly gone away, and I've never felt healthier. I don't even remember feeling this good since I was a child. So I'm so beyond grateful, and I 100% believe that my health is getting back to where it needs to be due to taking the implants out.
And when did you first start to see symptoms related to your breast implants?
Well, I've had symptoms over the years, but I was unaware that it was associated with the implants. So I had depression, I had pain, and I thought it was normal. I'm just like, oh, I can't lay on my side. That's normal. I have implants, And the symptoms, they got worse over time. But in the past couple years, I really started to focus on my health. I was doing everything right, and I was just getting worse. I was getting more sick, and I would get migraines all the time. And then I had trouble sleeping. The inflammation in my body was getting worse and worse, where I was having crazy cravings, and I was struggling with depression, where I wouldn't want to wake up in the morning. And all of those have really went away, and not instantly, but some of the stuff instantly did go away. And then the biggest thing, which I'm really excited about, is my thyroid. I just got blood work back, and my thyroid is normal levels finally for the first time in since I was a child. So
This is fantastic news. And Dr. Rankin, you are the root cause of all of these incredible, incredible feelings that she's having. So thank you for that.
Yeah.
Now, in 2020, the top 10 symptoms reported to the Food and Drug Administration, the database by women with breast implants. And these symptoms included fatigue. Fatigue was the highest one at 50%. And then they had brain fog, joint pain, anxiety, depression, rash, hovering at 20 to 25%. And interestingly enough, autoimmune diseases, inflammation, and weight problems at about 20%. So these are real statistics. Dr. Rankin, BII, as we know, can affect people with any type of breast implant, including silicone, gel filled or saline filled or smooth surface or textured. And we know that BII can develop whether implants have ruptured or stayed intact. Are there specific types of breast implants that are associated with a higher risk of BII?
In my practice, I take out a lot of smooth, textured, silicone saline. I would say a larger proportion of my patients with BII type symptoms do have silicone implants. With that being said, I have plenty of saline patients as well, because we know the outer shell is still a silicone outer shell. So we're still trying to put together the statistics of percentages of women with each type of implant and symptoms.
And I'm going to piggyback off of what you just said, just to clarify, not to scare the entire population with breast implants that currently have them, but it's important to note that breast implant illness is not the same as the rare types of cancers that can develop in the scar tissue and the fluid surrounding a breast implant, such as breast implant associated anaplastic large cell lymphoma, which I mentioned at the beginning. And there's other forms of lymphoma and breast implant associated squamous cell carcinoma. But it's worthy to point out that BII, of course, can aggravate cells that are predisposed to cancers. So that's the correlation and the domino effect here. Now, Joy, you recently explanted with Dr. Rankin. And Dr. Rankin, you have a protocol about going about your diagnoses with most women, although they are at the end of their rope, if you will, when they come to you. Joy, how long after explanting did your symptoms take to reverse?
I started to see a difference right away. I think the mental part of it, as soon as I woke up from the surgery, I mentally was so clear and so excited, and I didn't regret my decision for 1 second. I was like, why didn't I do this sooner? And then my health just started to get better and better as I was recovering. And I checked my blood work periodically every month since, and it's gotten better to the point where I've gotten off medication completely. So I'm really excited about that. And that's 6 months later.
Wow, what a difference. Dr. Rankin, this must warm your heart.
Hearing stories like Joy, that's why I do what I do, and I hear it every day in my practice, and that's very rewarding.
It sure is. Now we're going to talk about capsulectomy because this is a very, very important part of the process. So, why is the removal of the implants and the capsule so important? Let's chat about that. So, the when we talk about the removal of the implants and the capsule, which is the scar tissue that grows around the implant, is what many surgeons and countless women believe must be done to make a full recovery. What are your thoughts on this and why?
There's a lot of different thoughts of opinion on this in the plastic surgical community. In my practice, seeing the possibilities of developing problems within your capsule, like the ALCL and the squamous cell that you talked about, those are reasons in and of themselves to remove the capsule. There's been some doctors that have had studies saying that some of the silicone particles can leach into the capsules. There's been other studies that have refuted this also. So we're still trying to make sense of why we need a total capsulectomy. I think if you look at the surgery itself and the possible problems we can have with the capsule, it's just prudent to remove it when you're doing the surgery.
And you're right on the money. March 8th of last year, 2023, the Food and Drug Administration released an update to its September 2022 safety communication about squamous cell carcinoma and various lymphomas in the capsule around breast implants. So,
Right.
if they're documenting that that's where the squamous cell carcinoma and various other lymphomas live, then the obvious mitigation to this is to remove the capsule and do a capsulectomy, especially when there's more than 365,000 women that have received breast implants in 2021. That's a statistic. I'm sure that number has gone up, but that alone in 2021 was a 44% increase from the year before. So breast augmentation still remains one of the most common and popular plastic surgery procedures performed in the US. So it's really, really important to spread awareness about what Joy went through, what I went through, and what all of your patients have gone through silently suffering without anybody giving them the credence that they deserve. Now, Joy, when you suspected you had BII, did you ever second guess yourself? And what steps did you take to seek a diagnosis and treatment before you got to Dr. Rankin?
Okay, yes, I definitely second guessed myself. So many people told me that I was going crazy and that I was fine, and it was all in my head. And I thought to myself, well, even if it's all in my head, I still think that once I remove my implants, I will have a recovery. Even my head will be better. I needed to. I trusted my intuition on this because I read so many conflicting things. People were telling me this and that. So I really just trusted my gut, and I talked to Dr. Rankin, and he told me the facts, and I felt so safe and comfortable, and I just knew deep down that it was the right decision after talking to Dr. Rankin.
And that right decision it was, because guess what? All your symptoms have still slowly started to dissipate since 6 months ago, and you're on the right track and on the path to recovery, mentally, emotionally, and physically. And that's the most important part. Now, you're not alone in your internal conflict, because the debate regarding the possibility of breast implants causing systemic symptoms has actually been present since the 1960s, Joy. It's a theory which stemmed from an author's concept of human adjuvant disease, and it refers to human exposure to a foreign object that causes autoimmune or rheumatic disease. And the theory was gradually introduced to the public during the 1980s and later gaining the attention of the Food and Drug Administration, which in part led to the removal of silicone implants from the market in 1992. So this has been around. They have just suppressed the information because big pharma is a cash cow and they need to keep implanting women at our own risk, which is really sad. Now, Dr. Rankin, some doctors and surgeons and other medical professionals, to Joy's point, don't believe that breast implant illness is real, with many chalking it up to a kind of hysteria fueled by social media. So, and I'm going to go one step further. A research review published in Aesthetic Plastic Surgery in 2022 titled Breast Implant Illness, Real Syndrome or a Social Media Phenomenon. Then they go on to say that BII is a condition characterized by elusive diagnostic criteria and self-reported diverse, disabling, and distressing physical and psychological symptoms. Then the authors wrote that the condition is perhaps becoming the most controversial subject in aesthetic and reconstructive breast surgery, generating heated debates between those who do not believe such a condition exists and those who demand its acceptance as a recognized diagnosis. I'd love to hear your thoughts. What do you say to this?
All I can say is, in my practice, doing 500 explants plus a year and seeing the majority of my patients improve and say they feel better and say they feel healthier, the proof is in the pudding. You look on social media, you have all these groups of women getting together, discussing their symptoms, discussing their process, and just speaking the truth. There's no need for these women to make things up. They've been struggling for answers for a long time. Their health has declined for a long time, and they're getting better. And you can't really stop the power of social media and women collectively getting together and going over this topic.
Exactly. And because BII isn't well understood and the symptoms are so diverse, many doctors either don't know about the condition or haven't even connected the dots between the wide range of symptoms and the possibility that breast implants could be the cause. And other doctors and surgeons just don't believe it's a real condition. Now, the FDA, however, let's go back to the tape, is aware of BII and has been since at least 2019, when the FDA alone released a statement that read, "The current evidence supports that some women experience systemic symptoms that may resolve when their breast implants are removed, referred to by some patients and healthcare professionals as breast implant areas." Breast implant illness, period, and the end. It's written there, it's set in stone. The FDA themselves put it out there. So the debate is over in my mind. Now, Joy, after explanting, did you choose to reconstruct, and what did this entail?
No, I actually just explanted, and Dr. Rankin advised me just to not have to do a lift. He said that everything would be, looking amazing, and I just had to be healthy. And you know what? I'm so glad I just listened to him. I got the implants out, and I've never felt better. I've never looked better. I was scared that I was gonna look awful after, and what that would do with for my career. But honestly, I've been working more than ever, and I feel more beautiful in my natural own self. And I think this is part of my journey of falling in love with myself. So I'm hoping that I can encourage other women to find that within themselves and not need to put a foreign object in their body to feel loved or to work in this industry.
Oh, you said it, sister. Thank you for sharing that. You are 100% right. Now, Dr. Rankin, what advice do you have for women wanting to explant but really just fearing this step?
I mean, it's a tough decision for sure. I recommend you go to a surgeon that does a lot of explanting, has a lot of experience, board certified by the American Board of Plastic Surgery. Like everything in life, experience is key, and you want to find someone that can guide you through the process and make you understand your expectations going in, because it's definitely a challenging process. Particularly some women are going to do great, and other women with thinner tissues and larger implants, it's more challenging aesthetically. So experience is the key for this.
You have your work cut out for you. You sure do. And you have a lot of women that are big, big fans of yours, and now even more. Joy, what advice do you have to women out there thinking they're crazy and that their symptoms are psychosomatic?
I think anybody that's listening to this right now, deep down. I think once I started hearing from other people, it just clicked for me. I'm like, "Oh, that's me." I know those symptoms are because of my implants. So I think, just trust your gut, trust your intuition. And if you really feel that these symptoms are because of your implants, they probably are, and you're not crazy. And just follow through. Do your research, find an amazing doctor. Dr. Rankin's my favorite, and I did a lot of research before I found him. And yeah, just make sure that you just do what's best for you. And usually that's an explant.
Well said, my darling. Well said. Well, we are at the end. Thank you so much for coming on. Dr. Rankin, thank you so much for coming on and always being so transparent, full of information, educating not just the public, but other fellow surgeons in your field about the real stuff that women are struggling with that nobody else wants to talk about.
Thanks, Ann. It's always my pleasure to be here.
Absolutely. Guys, although not an official disease diagnosis, breast implant illness is a complex collection of symptoms that occur in previously healthy women after having breast implants. And it can affect the entire body and include physical and psychological symptoms that are often severe and debilitating. And the symptoms are so numerous and varied that it's difficult for doctors to arrive at a diagnosis, and it confounds many of them. Thank you both so much for coming on. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. That was The Rankin Difference, brought to you by David Rankin MD. And remember, there is a black box warning. This is real stuff. Breast implants can cause a type of cancer of the immune system called breast implant associated anaplastic large cell lymphoma. And people with silicone or saline breast implants have developed this rare disease, which can be deadly if not treated. The U.S. Food and Drug Administration, the major plastic surgery societies, and other health authorities have been devoting more attention to BII than they had in the past. And in October of 2021, the FDA began requiring breast implant manufacturers to include this black box warning: implant at your own risk. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. We'll be right back after this.